9 in 10 Malaysian adults have experienced periodontal disease and dental caries based on a study by the Health Ministry. Teeth is for a lifetime. However, not many of the people can retain their complete dentition at the elderly age. Some of the contributory reasons for early loss may be related to sugary diet consumption, chocolate fans, taking carbonated drinks, as well as tooth loss following traumatic injuries. Teeth are important as it helps us to chew food efficiently, pronounce words intently, bringing self-confidence and good looking. Hello, Assalamualaikum. So today we are come with one of the solution for that problem, which is denture. In this video, we are going to talk more about denture. What is denture? Is it?
Dr. Siti Fadriah binti Ahmad was a lecturer of Faculty Dentistry, University of Malaya. She graduated from BDS, University of Malaya, and she have master on fixed and removable prosthodontic from University of Glasgow, Scotland.
If you look by definition, denture is for us commonly we interpret as something that is removable, which you can remove from the mouth, right? But some like US, if you say denture, it could be interpreted as fixed denture. Example like a bridge, apply bridge prosthesis. But here, if I just want to clarify, denture is the removable denture. Why do people look for denture as treatment? Usually people want denture because they want to restore the function, mainly chewing or mastication, aesthetic, and also for phonetics, speech. Muslim too, they usually come because they want to say they want to recite the Quran better. I had also a patient who is a muazzin, so he wants to say azan. So different people usually come with different treatment purpose. Thing is, denture is reversible, meaning you do denture. If you don't like it, we did not change anything in the mouth. Unlike bridge, you have to do some teeth preparation or crown. You have to trim the tooth. But denture, you don't have to trim the tooth. Sometimes modification needed, but it's not going to damage the tooth surface. So it is reversible. And then it is cheaper. And then it is repairable. Denture can be repaired. If it fracture, you can send for repair. But if bridge fracture, difficult to you cannot repair, but you just make a new one, and it is slightly expensive. So good thing is it is removable. You can remove and clean. It is reversible, means no damage to the present teeth done, and then it is repairable. The bad side is oral hygiene lah, if it's not taking care. But if the dentist did not give proper oral hygiene instructions, post-operative instructions, and patient did not wear the denture properly, did not clean the oral hygiene, and patient can accidentally swallow the denture.
Denture also has its own pros and cons. As it removable, denture can clean easily, but if the patient is not wearing their denture properly, they will accidentally swallow the denture that can cause bleeding of abutment area teeth.
Basically, it is suitable for all age. Unlike fixed prosthesis, you cannot provide fixed prosthesis at younger age. Bridge or crown, you have to wait until someone is passing the puberty age, no more growth. Then you can give some permanent prosthesis. So denture, because it is repairable, you can adjust, you can give start from younger age.
While most people associate dentures with older people like their parents or grandparents, exactly they are used to help people at any age. The younger patient can get denture after they have lost teeth or advanced gum disease or decay.
Basically, okay, I cannot quote government price because it is very much subsidized. But if you go to private practice, okay, let's say the denture paste itself, the pink color, kan? If you have seen a denture before, right?
Yes.
The pink color with one tooth, usually they charge at 200 ringgit. Or but the cost slightly cheaper lah. Acrylic is cheaper. But with additional tooth, they charge like 10 ringgit. So it is only like one arch can be like 200 something. But if you do bridge, replace only one tooth, already 300. A bridge is already almost 700. Compared to denture, is only 200 something. Denture has few stages. By standard, you have apart from examination and diagnosis, you have the primary impression stage, and then you have the secondary impression stage, and then you have the maxilla mandibular registration stage. I will explain each later. And then try-in stage and issue stage, and also review. Primary impression is where you impression using a stock tray, is a tray, standard tray with impression material and produce a mold. Then from there you make a study model and also a special tray that confined to the patient's intraoral. Take another mold. That is a secondary impression. You produce a working model. From the working model, you make a bite rim to measure the patient's bite height, ideal facial height. And then the try-in stage is where the denture is almost like the ready denture, but it is not processed yet. So patient basically look whether setting is good, the color, the shade of the teeth match the present teeth, or not too white or not too dark. If patient is happy with the try-in stage, that will be processed. And then, so basically there are 5 stages, 6 stages including review.
Whether you have partial denture or full denture, your oral care routine needs to change in order to ensure the health of your entire mouth.
Okay guys, we have discussed more about denture. What is denture all about? And we also have discussed about pros and cons, about their cost, and also about the procedure to make a denture. So, do you think it is suitable for you to wear a denture in early age?
Do you guys want to try the denture treatment after this?
Do you want to boost your self-confidence about your appearance?
We care about
your
your
smile.